this is really about engagement and about relationships. And I would say that one of the biggest themes from the research that we've done both in the US and globally, and I work a lot on polio eradication and other vaccination immunization issues, and it's across the board, is really about the importance of trust in the person who's giving you the vaccine. So we see that this is on the doorstep when you're in Pakistan and Afghanistan, and we see that it's important in the US. We see it across the board. This is really kind of a universal human issue, I think, in many ways. And so trust is so key, and I want to put this into the context of information and communication in the States and say, you know, the sort of vaccine distrust that we see is not just specific to vaccines at the moment. So if we just think about the context, we're at the lowest level of trust in almost every institution you can think of. The government, generally, not just public health. We don't have to just blame ourselves for this. There's more to it. It's also distrust in the medical system, and as doctors are more part of hospitals, fewer have private practices, there's less of a connection. There's a lot of pieces that I think go to that, and so we can see kind of unraveling of trust in that, and that's worrisome. And I think, you know, we've talked a lot about sort of the information that's out there, but I think the key is to try to understand what catalyzes. It's not as though everyone who's walking on the street says like, oh, rumors coming by, I think I'll believe it. You know, it's just, no, it's not how it works, right? There's a reason that it makes sense to you. And so if we think about the reasons that it gets catalyzed, that it suddenly makes sense to you, I think that can give us some insights about what we can do.